Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Tens of millions of Americans experience heartburn, stomach pain, bloating, and diarrhea after they eat certain foods. Here to talk about food allergies and food sensitivity is Dr. Hannah Wangberg. She is an allergist and immunologist with the Scripps Clinic Medical Group in San Diego, California. Doctor, thanks so much for being with us.
Thanks so much for having me, Susan.
So, what causes somebody to be allergic to food?
Yeah, so food allergies develop when the immune system inappropriately starts to react to specific foods because it thinks that food is dangerous. And certain foods are more likely to trigger the immune system into making what we call allergic antibodies in response to the food, which contributes to the symptoms of an allergic reaction.
So, what kind of foods are we talking about?
Yeah, so one of the foods is peanut, and I think many people have heard about peanut allergy, but other foods can do it too, such as tree nuts, which includes cashews or walnuts, milk, egg, fish and shellfish, wheat, soy, sesame. Those are some of the most common foods to trigger food allergy.
And talk about gluten intolerance. What is that?
Yeah, so gluten is found within bread products, and gluten intolerance is a sensitivity to gluten, but it's not triggered by the immune system.
And what about celiac disease and lactose intolerance, food additives?
Yeah, you're highlighting a lot of different things that can happen with different foods, and celiac disease is an abnormal immune system response to gluten. It's different than gluten intolerance, though the symptoms can overlap. When a person with celiac disease eats gluten, it triggers inflammation in their intestines, and they can have all sorts of symptoms like bloating, cramping, abdominal pain, and those symptoms can also occur with gluten intolerance as well.
So, why do they trigger these reactions?
Food allergies develop when the person starts to make IgE allergic antibodies in response to a food protein. It's the immune system making a mistake and thinking that a particular food is dangerous. In contrast with celiac disease, it's also an immune system response, but it's not involving the production of these allergic antibodies. Rather, the immune system inappropriately leads to inflammation in the intestines.
So, how soon after you eat food do you know, yeah, I'm having a bad reaction to this food?
With food allergy, it happens quickly, oftentimes within minutes of ingesting the food. Other times it can be a little bit later, but with food allergy, we tend to think of these being very rapid in onset.
And what would the reaction be?
It can be quite variable with food allergy, but oftentimes there's some skin symptoms. A patient may experience itching. They may have hives, which are red raised bumps all over their body. They may have swelling. Other times, they may have vomiting or diarrhea, abdominal pain. And in more severe cases, there may be difficulty breathing or even hypotension or losing blood perfusion to the brain.
At what age would these food allergies start kicking in?
Food allergies can show up early. So no one is born allergic to a food, but you can be born with a tendency to become allergic to things you're exposed to. So often parents start giving their infants food at around 6 months of age, and food allergies can show up that early in infants. So unfortunately, it can affect anyone at any age of life, from infants to adults.
And who's most at risk?
So, having a family history of allergic conditions is a risk factor for developing food allergies. So, asthma, eczema, seasonal allergies, all of those in the family history can raise an individual's risk of having a food allergy. We know that infants and toddlers who have eczema are also higher risk for developing food allergies.
So, what's the difference between a food allergy and food intolerance, food sensitivity? Or is there a difference?
Yeah, there's definitely a difference. With food allergy, it's driven by the immune system, and the symptoms in food allergy can be variable, but they do have the potential for these reactions to be life-threatening. In contrast, with food sensitivity or food intolerance, a patient does have bothersome symptoms when they ingest the food, but they're not at risk of having life-threatening reactions such as anaphylaxis.
And what's anaphylaxis?
Anaphylaxis is a serious allergic reaction to a food that can involve multiple organ systems, such as hives, difficulty breathing, vomiting. It doesn't present the same way for everyone, but it's definitely a severe reaction.
So, what diseases cause food intolerance?
Well, anyone can have a food intolerance. It's just a unique way that their body reacts to the variety of foods that they eat. But certain people are likely more prone to it, especially people who have irritable bowel syndrome. They may be suffering from a lot of bloating, cramping, diarrhea. Those people tend to have more food intolerances than others.
So, if you're having problems after eating, when should you go see a doctor and for what kind of evaluation, what kind of testing do you do?
With regard to food allergy, if you start having hives or reproducible consistent reactions after eating a certain food, it's definitely something you'll want to bring up with your doctor. And to evaluate for food allergy, oftentimes we'll do skin testing. So you come into office and we have you stop your antihistamines and we do a prick on your skin to see if you have a positive test. But sometimes we'll also do blood testing. And so it really depends upon each individual person how we evaluate it.
And then, once you have the diagnosis, how long after you eliminate certain foods will you see results?
With food allergy, we often see improvement in symptoms quickly after you eliminate the food from your diet. You stop having these significant allergic reactions, and really, we often advise avoidance of the food moving forward. With regard to food intolerance, same thing. A lot of times the symptoms do start to improve after you've eliminated the food from your diet.
If you don't get a handle on treating your food allergies, what can happen long term?
It's really important to get a handle on treating your food allergies. Working with your allergist will often create something called an allergy action plan. And we teach people how to recognize the symptoms of the allergic reaction and also train them on how to treat a severe allergic reaction. Sometimes we give them a drug that's injected into their leg, or we may give them a drug that's sprayed into their nose. But creating an allergy action plan is very important if you have a food allergy.
Any final thoughts, doctor?
Yeah, so if you or your child is experiencing consistent reactions with peanut, bread, cow's milk, egg that involve symptoms like hives, swelling, difficulty breathing, these are definitely concerning reactions. I do think that it should be evaluated with testing and consideration of the various options to manage the food allergy.
Doctor, thanks so much for taking the time to be with us. We appreciate it.
Thanks so much for having me.
If you want more information on how to diagnose and treat food allergies, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.